process came to me when I was faced with a patient having a neck which was shortened such an extent following a Perthes disease. We don't know what to do. It's a 17-year-old boy. Can't offer him a total hip replacement, just too young for that. And what were the options available? So I did some research on it, and he had a good osteotomy which I came across. And this I got a chance to apply in this 12-year-old female who had a similar kind of an X-ray picture. The problem was she had fatigue pain after walking for a distance, say, of about 200, 300 meters, and then the hips would start to hurt and her lurch would increase. And she wanted some correction for that. Again, a replacement at this point of time is not an easy job. Plus, at 12 years, I hadn't done it any time before. So this is the osteotomy which I planned. This is a known osteotomy called a Hassler's osteotomy. Anybody else has any other options on this? We can discuss, or I'll just go ahead with the osteotomy itself. The panelist has any other options for this? Sir?
Go ahead, I think.
Sorry?
Seeing it for the first time.
In any case,
it has been very well publicized. His osteotomy in a WUMEDI, there is a lovely, excellent video of the author which is there. It is a nice thing, and this is the picture from there only.
Correct. Picture from there. When I did this in 2012, that was the first time ever that I had seen anybody do it. I didn't have accesses there. So the triple osteotomy, 3 osteotomies planned well. What was different about this was, I'll not go into the rationale. We all know, if you increase the abductor lever arm and decreases the force on the hip. Implant I used here was kind of a modified angle blade plate because the neck was too narrow. So I had to modify or make a new implant. I call this the prong plate. It's like the angle blade plate, but 2 prongs, so make it a little easier for me to insert this. The plan, the 3 osteotomies done. The proximal, start from proximal to distal. Get the neck lengthened. That's the intra-op picture. Here, even those prongs were actually insufficient. One of the prongs was going out of the bone, so I had to actually cut it out. And that's the intra-op final picture. That's about 4 months. Sorry, that's just immediate post-op. That's about 2 years post. So what is the future course now? Does this patient is quite okay? She's walking now. She's 10 years. But what about the hip joint? Does it progress into arthritis, or does it stay as what it is? Any inputs on this, sir? Yeah. Yeah, but it does make the total hip replacement a little easier now that the anatomy has been restored more or less normal. Your abductors is back in place, your neck is relatively lengthened. I had a similar case where we had a non-union with a pathological, a kind of pathological fracture because of the varus deformity of the proximal femur, resulting in a neck injury. Similar kind of an implant used and with a similar result. I think for the want of time, I'll not just go forward because it's more or less the same. The only issue I had here is that the implant design is little weak for an adult. This was a lady who was 23-year-old. And eventually I had a problem of this collapsing into varus. The neck femur united, but the intertrochanteric area went in for a varus deformity. This looks good now, but eventually it did go into varus.
He has described it with the blade plate.
Yes.
Nice, strong, thick blade plate.
So that is one lesson which I learned, that you can't extend a locally made implant when you have better options available. So I would have now used, obviously, she has problems on both sides, so her gait is not completely restored, and she will require a correction on the opposite side. The opposite hip is arthritic. She'll probably require a replacement.